The cardinal sign of an aneurysm rupture is a patient experiences a sudden, severe headache, which is the worst headache of their life. It's unmistakable. Patients describe being hit in the head with a baseball bat or hit in the head with a 2x4. They usually have to lay down, stop what they're doing, and often they'll end up going to an emergency room if this occurs. The headache comes on suddenly. It's also usually associated with a stiff neck, and the stiff neck is caused from the blood going down into the subarachnoid space, or the space around the brain, and that causes irritation. A stiff neck after an aneurysm rupture usually can last a week or two. Occasionally, patients will go home or go to a physician's office if it's not quite as severe, but the headache is of the magnitude that it will make patients go to the emergency room in most situations. For an unruptured aneurysm, if it's small, the chance of it rupturing within a certain time period in the next several weeks is pretty low, so we can usually plan to repair that on an elective basis if it needs to be repaired. Some aneurysms which are discovered are too small or of a configuration that we decide not to treat it at the time, but may follow it out over time with scans every year or every 2 years to judge if it's growing or enlarging in size. If it's decided that the aneurysm is a certain size and risk that it needs to be treated, then we'll plan for the treatment, either the clipping or the coil treatment.